Lauri Brouwer and Dr. Leila Turner here with Living Wellness Medical Center. We are going to be talking a little bit about some symptoms of menopause because on our Facebook page we've gotten some questions. I get these common questions. They're really frequently asked by my patients. So do you want to read a couple of the questions?
I do. I have some questions for you. Ready for our first question? Is difficulty losing weight a symptom of menopause?
Very commonly, yes, it really is. So at menopause, our ovaries stop producing hormones for us in the quantities that they used to. So for instance, if a woman's estrogen level was 150 before menopause, it can drop as low as 5. So it's pretty absent. And with that dramatic reduction in hormones, it impacts not only the ovarian hormones, it drags down our thyroid hormone, which really sets our metabolic burn rate and how easily we lose weight. So it's really common that when all these hormones go out of whack and shift around, that weight gain is a really common result.
I heard a really interesting statistic, which is a woman cycling, having her period. She burns almost 300 calories a day just having a cycle. So to complicate the issue is when she gets to menopause and she stops ovulating, she's now got these extra calories that are not getting burned. So the complicated web of menopause, right?
Absolutely.
All right, you ready for the next question?
I am.
The hot topic, what do you think of bioidentical hormones?
That is a topic that is near and dear to my heart. Sorry, just hit my mic. That's one that I really love because I've done extensive extra education since medical school, learning about hormones and bioidentical hormone replacement in particular. It's a very complex subject, and a lot of doctors don't take the time to really study all the literature that's out there and get to know about bioidentical hormone replacement. So there's still a lot of myths and fallacies that are spread around about lack of safety using bioidentical hormones, but did you know that women who use hormone replacement therapy actually have a lower risk of breast cancer than women who don't? We preserve the function of our breast tissue and keep it working right, less likely to grow those cancerous cells. So yeah, it's very safe. And I personally think, as a naturopathic doctor, our bodies are designed to work with hormones, and they don't function well once those hormones are gone. So replacing them is actually the best preventive medicine that I know of. So yeah, safe and effective.
Awesome.
Yeah.
The other thing I think that gets complicated for people is how many different hormones there are and how many different routes of administration are there. There's creams and topicals and lozenges and sublinguals and sprays and pellets and injections. So do you go over all of those options with your patients?
Definitely do. Yeah, we spend a lot of time at the initial visit talking about hormones and what they do, and then once we're going to start a therapy, talk about all the different ways that we can administer it. There are benefits and drawbacks to each different type of administration, so we need to know the patient's individual tolerances and their health history to know which one's just right for them. But yeah, it's really complex, but it's a mystery that I love solving.
Well, the next question actually flows into this. At what age should a woman start getting bioidentical hormones?
At the age she starts becoming deficient. There's no set time. So, early menopause is actually before age 40. So really, any time from 40 on, your hormones are really going to be shifting and changing and heading towards that menopausal drop-off. I have some women that are even younger, in their 30s or 20s, if they're using hormonal birth control, that's throwing their hormones off so dramatically that I want to start some kind of a replacement or balancing program even then. But as far as strictly menopausal bioidentical hormone replacement, I would say start checking around age 40 or anytime your periods start to go off and they start to change. That's an indication that it's around the corner.
Cool. All right. Those are our questions. We're going to start taking questions from our Facebook page. So if anyone has questions, feel free to post them. Our Facebook page is Living Wellness Medical Center, and our website, livingwellnessmedicalcenter.com. And Dr. Brouwer offers free 10-minute phone consults. If anyone's interested in calling to chat with her about bioidentical hormones, go ahead and give us a call.
Great. Yeah.
480-588-6856. Take care.